this activity thing affects so many parts of the recovery. One of the things that we'll talk about, or if we haven't yet, is blood clots. And blood clots after a total joint are one of these sort of monsters under the bed that we worry about and say, oh man, this could be a horrible problem. How do we minimize the risk of blood clots? If you get up and walk the day of surgery, that's a tremendous decrease in your risk of blood clots.
Describe the problem. Why is blood clot such an important thing to be aware of and to prevent? In other words, there's going to be good motivation for me if I understand how badly I want not to get that blood clot.
So the blood clot in itself in your leg is not a problem, but if you think about doing the knee replacement, that's a fairly traumatic event to the leg. And one of the things that promotes clotting of blood is trauma to an extremity. And so you can get blood clots that form in the large veins of your leg. Now, veins, as you will recall, is a pipe, if you will, that takes the blood back up to the heart and through the heart to the lungs. And so if you get a blood clot that happens to break free from that vessel in the knee.
And the blood vessels keep getting larger as they come back to the heart.
And it goes up in the leg and then up through the torso and through the heart, and it lodges itself in the lung. That can be a devastating, life-ending event. And so that's called a pulmonary embolus. And pulmonary embolus is something that what happens is you can no longer get oxygen to blood because half of the lung or part of the lung is actually blocked off by that blood clot. And now you're not oxygenating the blood, and it's going past the lung and back out to the body without oxygen in it, and you end up, you can die from this event. It's a very sudden thing. And so we worry about blood clots always when we're doing total joint. There's a variety of ways that we actually work to minimize that risk, and maybe we'll just talk about that right now if you want.